hurts.
That hurts? Where does that hurt? Point to me with your fingertip. Right in there? Okay. Can you bring it up like that? That bothers it?
Mm-hmm.
Yeah. Okay. Let's see here. Go ahead and lay down on your back, facing up for me, please. All right. So if you just bring it up right now, you have pain?
Yeah, right there.
Right there? And on a scale of 0 to 10, how would you rate that?
About an 8 when I get up high.
Really?
So
Not bad.
pretty substantial.
Okay. Let me just get this little blue hand tool here. So you know that map of the shin that I was just telling you about. Point to me exactly where with your fingertip. Dora, go lay down. Right there?
Right here.
Okay, right there. All right, so I'm going to stimulate here. You just let me know if it gets to be too much, okay? Now go ahead and do it again. Raise your arm up. And better work, same.
Little tiny, not much of a difference.
Point to me exactly where with your fingertip. So the reason why I say point to me exactly where, because he's pointing to a different spot. You can't see it, but I can. He was here, and now he's over here. So this is an off switch for an area, like one finger size area of the body, like I showed you on those maps. But now he's in a different area of the body. So that means something to me. It's a different area of the body. I need a different area, the shin that connects there. And go ahead and do it again for me, please. And what about now? Better or same?
A little bit better.
Still there?
If I go, I feel like I can bring my arm up higher.
Yeah, you get more range of motion.
But it is still there, but maybe a 5 instead of an 8.
Okay, point to me with your fingertip.
I find it. Let's see here.
There? So now he's way more up here. Okay, so that's a different spot to me. Or it's actually about right in here. So I'm gonna adjust and move down here. So we got a little bit more range of motion that time. Seems like he gained about 5 or 10 degrees more. Now go ahead and do it again for me. And what about now?
Maybe about 2.
Okay. Point to me with your fingertip, exactly where. So so originally he told me he had pain right here, but he had pain everywhere. But his brain interpreted the most painful area, and then you relieve that, and it's like, oh no, it's here, no, it's here, no, it's here, no, it's here. He chased it around and it's gone.
So here.
All right, so that's a little higher up there, right in there.
Yeah.
There. And try that.
A little bit right there hurts. It's substantially better though.
On a scale 0 to 10, how would you rate it?
About 2.5.
2.5. And point to me exactly.
It's hard to find now.
Yeah. What I think you're doing is you're jamming your rotator cuff right up against the bone. So you can always kind of push it a little bit harder, but we'll see if we can get it.
Yeah, right here.
There? So I'm going to move to a different area. I'm going to move, there's another map right here on the leg here. Let me know if this is too much, okay?
Mm-hmm.
ahead, do it again.
That's pretty good.
Is it still there? Would you call it the word pain, or is it like a tightness, or like?
It still hurts, but when I go all the way up, but when I first came here, I could only go up to about here.
Right. So you'd still call it pain?
Yeah.
All right. Now point to me where that is. Right there. And I'm going to hit this again here. The reason why I say would you call it the word pain is when I teach this, I always say make sure you ask your patients that when you get down to a 2 out of 10 or less, or sometimes a 3 out of 10, but 2 out of 10 or less, there's a word that nobody uses the same word. Some people call it sore, tight, hot, numb. Nobody uses the same word, and what they're talking about. But you ask them, would you call it pain? They say that there's no pain, and they usually have full range of motion. And what that is like a residual kind of like you have an injury there. It's like a soreness or something, but it's no pain, and they have full range of motion. Let's try that. Go ahead.
That's pretty good. I'd say maybe just a little bit uncomfortable, but I wouldn't really call it that anymore. Just some soreness.
Sore with the 8 out of 10 that you started with. You said 8, right?
Yeah.
Then go ahead and stand up for me. And let's see. And then raise your arm up.
That's a hell of a lot better.
There you go. Awesome. Yeah, he started at about like here, if I remember correctly, and now he's all the way up here.
Even doing this hurt a lot, and that's maybe just a little uncomfortable, but that's a big difference.
Awesome. Awesome.
Thank you.
Yeah.